Just waiting, just waiting. Okay, perfect. Hello, everyone. I am live on Facebook as well as Instagram. And today we are going to talk about a very important topic. We are going to talk today about 5 signs you have a metabolic disorder, right? So, this is something that is extremely interesting. This is something that is not as popular as common conditions called diabetes or common conditions like high blood pressure. This is a triad of symptoms where we are going to discuss whether you have a metabolic disorder or not, right? And one of the key things to understand here is the concept of metabolism. So, when we talk about metabolism, it is the chemical process through which your body is going to transform food that you eat into fuel, and that's where your body is going to use up the carbohydrates, the proteins, the fats that you eat, and biotransform those and try to use it for the fuel it has, right? Often when this process fails, different conditions can occur, and one of the most common conditions that we are discussing for this entire month of November is diabetes. So diabetes is the most common condition, but there are other factors, right? So today we're going to discuss about a syndrome called metabolic syndrome, which should also be called as cardiometabolic syndrome, because a lot of repercussions, a lot of the complications, a lot of risk factors, that it leads to is going to be about the cardiovascular system. And we will talk about the risk factors, we'll talk about the signs of metabolic syndrome, right? And this is extremely important because metabolic syndrome is a cluster of conditions, but it cannot be seen easily, right? Or people take it too lightly. And though this is extremely common, if you look at the US statistics, at least one third of the US adults are going to struggle with metabolic syndrome, right? And you need to have at least three of the criteria to be fulfilled for it to create those issues or for you to be diagnosed with metabolic syndrome, right? So that's what we're going to talk about. If you are watching this live, say a quick hi. If you are watching this as a replay, you can put a hashtag as replay. If you have any questions for me at any point of time, I would love to answer those, right? So let's get started. So, what exactly is metabolic syndrome? Metabolic syndrome is a cluster of different conditions which can occur together at the same time, right? And it will increase your risk for three main conditions. It will increase your risk of heart disease, it will increase the risk of stroke, and it will increase the risk of type 2 diabetes. So that is something extremely important to understand. I'm going to say a quick hi to Isha. I'm going to say a quick hi to Harsha as well. And if you are on Facebook, Carla is saying a quick hi. Okay, hi Carla, right? So going back to metabolic syndrome, it's like if you just have one condition, from these, you're not going to be having metabolic syndrome. So metabolic syndrome has a criteria where you have to have high blood pressure, you will have high amounts of blood sugar, you will have excess fat around the waistline, right? So if you look at the belly fat, if you are having an apple shaped body, right? A pear shaped body is where a lot of your fat is concentrated around your hips, but when we talk about an apple shaped body, a lot of your fat is going to be concentrated around your waist and midsection. Not your hips, but your waist and midsection. So that's what's known as an apple shaped body. And that is going to increase your risk, for the conditions we talked about. And there could be abnormal cholesterol or triglyceride levels, right? So when we talk about the guidelines, from let me quickly go for the criteria here, because converting those into perfect, yeah. So what is the guidelines? What does it say? That any three of the five criteria, right? So for men, if you have waist circumference that is greater than 40 inches, and women, if you have a waistline that's more than 35 inches, right? That's one of the criteria. The second one is the fasting glucose greater than 100 milligrams per dl, or your triglycerides are greater than 150 milligrams per dl, or your HDL cholesterol is lower than 40 for men and lower than 50 for women, and if your blood pressure is higher than 130 mm of Hg, right, for the systolic, or greater than 85 for the diastolic, right? So to convert it into Canadian, because Canadian uh, numbers are slightly different. So if you are a man and your waistline is greater than 102 centimeters, right, we're talking about the five criteria or the five signs that you have a metabolic disorder. Number one is that your waistline is greater than 102 centimeter, and for women, if your waistline is greater than 88 centimeter, that shows that you are filling one of the criteria. The second one is elevated plasma triglyceride levels, right? If you have more than 1.7 mmol of, that's going to say that, okay, your triglyceride level is high. If you have decreased HDL less than 1.03, right, for men, or less than 1.3 for women, and your blood pressure is elevated, especially your systolic is higher than 135, diastolic is higher than 85, and your fasting glucose is greater than 6.1, right? So this is the Canadian criteria, as well as I've talked about the American criteria. They are the same, but the units are slightly different. Um, so that shows that you have a metabolic disorder, right? And why do we talk about metabolic syndrome as the silent killer is because when you are diagnosed with diabetes, then you take care of managing blood sugar or you go on medications, right? Most of the times, if you have an expanding waistline and if your hands and feet, like, you don't feel that you're too obese, you're not going to take care of it, right? If your blood pressure is not extremely high, you're not going to take care of it. But when we talk about metabolic syndrome, there is a lot of this pathology going on in your system, right? And more than one thing. So your blood sugar is high, your cholesterol is high, your triglyceride levels are high, your waistline is high, but you have not yet been diagnosed with anything, so you're not going to pay that much attention. And often events like stroke, or events like any kind of heart attack, will open your eyes to what's really going on in the body, right? So this shows that your body is carrying a lot of inflammation, your body is carrying that excess fat as a result of the inflammation. And this also shows that there are chances that your arteries are going to get clogged earlier. So that's what this means, right? So we talked about the five signs of metabolic syndrome, we talked about the three main factors, that the metabolic syndrome will lead to. So Farid is here, Sumit is here. I'm gonna say a quick hi and see if anybody has any questions for me so far. So Carla is here as well, and yeah. Yeah. So there are some risk factors when we talk about metabolic syndrome, right? So age, definitely, as we age, um, that is definitely a risk factor when it comes to metabolic syndrome. um, Women after menopause are going to be more prone to it, right? So your age, your risk of metabolic syndrome is going to increase with your age. Your ethnicity in the US, if you look at the ethnicity, Hispanic women are at the greatest risk for developing metabolic syndrome as compared to men and women. Women after menopause are more prone to developing metabolic syndrome. Obesity is definitely a risk factor, right? So if you are struggling with obesity, if you haven't been able to lose weight, especially if you're carrying too much weight around your abdomen, this is going to increase your risk of metabolic syndrome. Certain conditions like diabetes is going to increase your risk of metabolic syndrome, right? Or like a history of gestational diabetes, a family history of type 2 diabetes, again there's an increase. And if you look at other conditions, now metabolic syndrome is also higher, the risk is higher if you have non-alcoholic fatty liver disease or polycystic ovarian syndrome or sleep apnea. So when we talk about PCOS, polycystic ovarian syndrome, again a lot of the pathology in the body is connected with something called insulin resistance, right? So you're secreting insulin in the body. It's not that you don't have reserves of insulin, or it's not that your pancreas are not putting out insulin. The fact is that your body has insulin, it's secreting insulin, but your cells are not sensitive to it anymore. And that's what, it means. So PCOS, like obesity, diabetes, high blood pressure, high cholesterol, they all come together in creating this metabolic syndrome. And that's what's going to create a lot of issues in the body, and that's what is going to create your heart attacks or something if you don't take care of it right away, right? And what are the complications of this metabolic syndrome? What does it really mean? What it really means is you can get diabetes if you don't take care of it right now, right? And diabetes is not just about blood sugar. So when we talk about diabetes, everybody's like, oh, if I control my blood sugar, that's going to be perfect. It will to a certain extent, but you also have to understand that when there are a lot of fluctuations in the blood sugar, right? If your blood sugar suddenly is too high, is too low, or it drops too low, again, low sugar can be a fatal thing for people. And if your blood sugar is constantly going up and down, it's going to trigger your stress system in the body as well, which will create more issues, right? So that's one of the factors with diabetes. Diabetes, there are several complications, like, end arteries, you're going to lose the sensation, you're going to lose the circulation. And if there are any infections, it might lead to something like even gangrene, which is a big complication when it comes to diabetes, right? With metabolic syndrome, as I mentioned before, heart disease, heart attack, because your arteries are getting clogged, your arteries are also getting hardened, right? Atherosclerosis is very common. It is a known complication of metabolic syndrome, and it is a very serious complication of metabolic syndrome. Heart attack, it's a very serious complication of metabolic syndrome. Now, when you have metabolic syndrome, it also means that the same situation in the body, the inflammation in the body, can also create issues with your kidneys, right? It can create conditions like stroke, where if any of the artery in your brain gets clogged, right, there could be paralysis, that could be stroke. Peripheral artery disease is another complication. And diabetes, if you develop diabetes, other complications related to diabetes, like eye damage, which is diabetic retinopathy, or diabetic neuropathy, which is the nerve damage, or the kidney disease or amputation, those are some factors that could be created. Now Carla is asking, does hypothyroidism play a role? Hypothyroidism can play a role because it will lead to weight gain, right? Often hypothyroidism can lead to weight gain. And if your diet lifestyle at the time, because you have lack of motivation, right, which is also common with hypothyroidism, and you also struggle to keep that weight off. So if you are struggling with hypothyroidism, if you start gaining a lot of weight, if you develop poor eating habits, your blood pressure could go high, you could have abnormal levels of cholesterol and triglycerides as well. And often, if you look at chronic hypothyroidism, the blood lipid levels could be abnormal as well. So, most definitely, while directly most people don't associate hypothyroidism with a metabolic disorder, but thyroid itself is one of the main metabolic glands in the body, right? So, all the thyroid hormones are important in metabolism. And if one gland is not functioning optimally, it's going to create issues in different parts of the body as well. So from that perspective, most definitely, it will throw a lot of things off in your body and create different conditions. um, so we talked about the five signs, we talked about the complications as well. So now let's talk about what is the plan, like how do we do, how do we make a plan to get rid of the metabolic syndrome, right? So again, at the metabolic syndrome stage, you are not technically diagnosed with diabetes. You might have slightly higher blood pressure, but not enough to, you know make you like a make you be put on prescription medications. So this is actually the best time to start taking action to prevent heart conditions, or to prevent stroke, or to prevent diabetes. So you have to make sure you're changing your diet and lifestyle. right? So the number one thing that you need to do from a lifestyle perspective is get at least 30 minutes to 45 minutes of physical activity every single day, right? And a physic you have to change from like a couch potato or a sedentary lifestyle to an active lifestyle. And if you are somebody who's working and the nature of your job is sedentary, then you have to make sure you're taking some extra efforts to be more active throughout the day. And especially right now, it's getting extremely cold. After some time in Canada, like as soon as December hits, now the temperature is sometimes in the minus at night, but when it starts getting really cold, people are more homebound, right? So at the time, making sure you're keeping the movement, you're keeping the activity levels, because whenever you're exercising, your body is consuming the excess glucose in the body, right? When you're exercising, especially people that work out, if you're doing like any kind of cardiovascular like activity, right, where your heart rate is going up, you have to do it for a minimum of 30 minutes for your body to tap into the fat, right? So making sure you're doing good amounts of activity. You can do yoga, pilates, running, jogging, on a treadmill, on elliptical, swimming, like whatever you want, or playing any sport that you enjoy. There are indoor sports available as well in the winter time, but some kind of activity every single day for a minimum of 30 to 45 minutes a day is going to be the best thing, right? So to prevent this metabolic syndrome, and also to get rid of the metabolic syndrome if you're already developed it. The second one is you have to ensure that you're maintaining a healthy weight, right? And when we talk about maintaining a healthy weight, if the cause of your weight gain is hypothyroidism, as Carla asked, then you have to make sure you're treating the hypothyroidism, right? If the cause of your weight gain is a sedentary lifestyle, then as I mentioned before, activity is going to be extremely important. If the cause of your weight gain is a poor diet, right, then you have to change your diet and make sure you're losing the weight. So whatever is creating that excess weight, whatever is creating the obesity, that has to be taken care of. And you have to make sure you are a healthy weight, right? So that's the number one thing. The one thing that, if you're watching this, the one number one thing, if you haven't done it so far, is get a body composition test run, right? Because the BMI or the body mass index, I've talked about it enough, if you've been watching my videos. But body mass index, BMI, is not a very conclusive test. If you have high amounts of muscle mass, you are going to have a higher BMI. So it is not the best assessment of your body fat, right? But if you do a test called body composition report or the bioimpedance analysis, which I offer in my clinic, right, you will get the exact body fat ratio, you'll get the exact amount of muscle mass, you will get your hydration status as well. So this shows different parts of what's going on in your body, and this will also tell you exactly that, okay, this is how much fat I have, and this is how much I have to do for my age range, right? And my gender, this is what I should be having. So that is the number one thing you need to do, is book a body composition test if you haven't done it before. And that is something, do it as a gift for yourself, for Christmas. So everybody watching this, like, if you have a practitioner nearby, please book your body composition report. It will give you a lot of valuable information. And make sure you can do that. So the second one is, saturated fat and salt, right? We often talk about fat and going fat free. You do not have to go fat free, but you can reduce the amount of saturated fat in your diet. Now, again, this will differ from person to person. uh, if you are familiar with Ayurveda, right? So in Ayurveda, different body types, like somebody who's dominant in Vat Prakriti, will require more saturated fat. Somebody who's dominant in Kapha Prakriti, right, who has enough stores, who has a slightly oily skin, will require very less saturated fat or very less fats, right? So this is important to understand that you have to decrease the saturated fat. For people that are eating a lot of meat, animal meat, make sure you go for the lean cuts, right? Don't go for the fatty cuts. If you're somebody that's enjoying pork is a very fatty animal, lamb is also extremely fatty. So switching over to something like white meat is a good start for that, right? If you want to go for red meat, go for the lean cuts of red meat. So you're decreasing your saturated fat, right? Another thing when we talk about fat is trans fats. Trans fats are formed when you're cooking things at a really high temperature, right? Or certain oils, when you're passing oils under hydrogen to make oils which are liquid at room temperature into solids, right? The best example is margarine, which is spreadable like butter, but it's never better than butter. In fact, it could be disastrous for your body, right? So it's switching over from margarine to small amounts of butter is a good example. Cutting out the trans fats, cutting out the potato chips, would be a good start. So that's the third thing. Avoid saturated fat, avoid trans fats, and salt. Right, salt is again something nobody talks about, but salt can age you rapidly. If you look at the Ayurvedic core texts, we talk about the six tastes of Ayurveda, and salt is a taste that's going to make you age rapidly. It's going to give you a lot more gray hair earlier than you're supposed to, and it will make you retain water as well, right? Too much salt is disastrous for your system and will also increase your blood pressure. So not just the fat, but also the fourth thing is you have to cut out your salt intake along with your fatty intake, right? The fifth one is smoking. Smoking is a huge risk factor when it comes to metabolic syndrome. So limiting, if you are somebody who's been smoking a pack, try to reduce it by like 3 every week and then go off it, right? And there are different natural supplements available as well that can support you to stop smoking, right? So those are a few suggestions or the 5 steps that you can do to prevent or reverse this metabolic syndrome. Now again, depending on the levels, if you have higher amounts of triglyceride, if you have higher amounts of cholesterol, they will mean different things, right? So high triglycerides are stored energy. Often if you have high triglyceride levels, and I think I've mentioned this before as well, it's like you're not using up the energy that you have. If you have higher amounts of cholesterol, it indicates clear inflammation going on in the body, that you have lots of inflammation in the body, and that is why your cholesterol is high. If your triglycerides are high, you are inactive, you're not using up the energy, you're eating too many calories that are stored as triglycerides, right? So Harsha is asking me a few questions. Do you have a clinic in Mississauga also? Not really. There was a time I used to drive to Toronto to see, a few clients, but I haven't been in COVID. It's just like my clinic is super busy and it takes up a lot my time. But Harsha, if you have somebody else, that you can maybe just Google body composition report, around where you live and get it run. It's not super expensive. It's 40 to 50 bucks, but it will give you amazing information. And when you then aim for a weight loss change or when you start working out, you have to ensure that, your body composition is getting normalized, right? Often see people going on keto diet, for example, and lose all the muscle mass. They've lost weight, but they've lost the wrong kind of weight. So you're not getting healthier, right? Dana is saying, "Oh no, I just ate a ton of olives." Ha ha ha. So olives are monosaturated fat, so those are healthy, right? As long as you're not eating too much of it, because they will also have a lot of salt in it, right? So making sure, so these are very basic steps, right? Another thing I often talk about is including a lot of fiber. Fiber has this amazing capacity to flush your system out. Increasing your fiber intake will also ensure that the excess of cholesterol or triglycerides are flushed out of the system as well, especially cholesterol, right? So increasing fiber through fresh leafy greens, fresh fruits, vegetables are another fantastic options, right? um, I was supposed to talk about 5 things, but I think I can go on and on. Another thing is intermittent fasting. So unless you're pregnant or really weak or are really old, everybody or a child, everybody else can do intermittent fasting, right? Intermittent fasting is one of the really good ways to normalize your metabolism as well, because the more you keep eating, the more, without digesting it, the more inflammation it's going to create, right? The more challenging it's going to be for your body's metabolism to process different things. So intermittent fasting is another great option, will help you with weight loss, will help you correct your digestion, will help you kick in your body's natural process of cleaning things out, which is phagocytosis, right? In our body, any of this cells, for example, which are not doing their job, they have to die. So there is this process called autophagy, where the cell starts eating itself, right? That's kick started by fasting. So intermittent fasting, 12 hours is fine, 14 hours is fine, so do as per your capacity, or work with a practitioner so they can guide you to tell you exactly how much fasting your body requires, right? So this is a little talk about metabolic syndrome, right? We've discussed why it's a silent killer. We've discussed the risk factors, the complications, the signs, as well as the 5-step plan. If you have more questions, you can always post it in the comment section and post it here. If you have any suggestions, I'm going to be doing a lot more talks in the new year. So if you have any specific topics you want me to talk about in the new year, I would absolutely love to know those. This is my last Wellness Wednesday for this year of 2021. I am heading to India next week, like next Wednesday. So I won't be doing the next week's Wellness Wednesday, and I will see you directly in Jan when I'm back from visiting my family. So I'm really excited about that. But if you have any specific topics that you would like some information on, I would absolutely love to know, right? So if you have certain conditions that come to your mind, or in terms of diet, if you're wondering about a certain diet, I would love to talk about that and give you my point of view. So please, in the comment section, I would just let me know what it is that you're interested in, and I can make sure that for the upcoming Wellness Wednesdays in Jan, I can pick that topic, right? So thank you all once again for tuning in live. Thank you all once again for staying here. Today I was super busy. I haven't even been able to make a poster or post it ahead that I'm going to show up live. So thanks for being here. And I will see you all soon for Wellness Wednesdays in the new year. One another quick thing is, if you are on Instagram or Facebook, I am also having this Black Friday sale for a lot of my courses and short trainings. So you can also click on the Instagram bio, or you can click on the link on Facebook that will take you to my Prakriti Masterclass and a few other things that I have on offer for the Black Friday. This is my first Black Friday, so I'm kind of excited about that as well. So thank you once again. If you found this useful, please share it with somebody that you know needs this. You can either tag them on this video, or you can share this video with them privately. And the video will also be available on YouTube, right? So it gets processed, and then once you go to Dr. Manjiri Nadkarni, my YouTube channel, you will get all the videos right there. So thanks for tuning in. Thanks, Anna. Wells is asking me, have you done a PCOS talk that I could look up? I have diabetes, PCOS, fatty liver. I work hard to work out and hike a lot, but weight is really hard to keep off. So there is a PCOS talk that I have done, right? Definitely, you can go on to my YouTube channel. You can check that out. Diabetes, PCOS, fatty liver. Fatty liver shows me there's a lot of inflammation in your body already. Diabetes, PCOS are linked to the insulin insensitivity, right? So your body is secreting the insulin, but you're not sensitive to it, because there is a lot of inflammation going on. So one thing that I would do is definitely, go check out my videos. I've done several ones on diabetes, I've done a few ones on PCOS, I've actually done one on fatty liver as well, so you can listen to all the talks. But work with a practitioner, right? When you have tons of different symptoms that have become disorders, it's very hard to watch videos and treat them, right? And because this is YouTube or this is Instagram, I cannot give one-on-one advice, right? So if you're interested, you can just message me and we can set up some time. Or if you have a practitioner nearby, that is amazing. Start working with them, but get one-on-one support, because they can understand, they can assess your body, right? I do the Ayurvedic 8 point and 10 point examination before I even kind of decide what to give you as herbs or supplements or whatever. So work with someone, but all the information will be on my YouTube channel as well. So thank you for tuning in. I'm going to say a quick hi to Mithila and Tulsi Ayurveda, and I will see you in the new year for Wellness Wednesdays. Have a fantastic rest of the year, and I'll keep everyone updated with my travel to India. Thanks and have a fantastic day. Bye for now.